Assalamu alaikum, ultrascan diagnostics. Say this is the CBCT of the patient that you had requested. The area of interest is the lower left 6 region. As you can see in this sagittal view, the lower left 7 is impacted and also the lower left 8 is erupting over the impacted 7. We've got the 7 which is very closely associated with the 6. Now we're going to focus on the transaxial view of the lower left 6. So this is the mesial canal. The mesial canal has we've got two canals initially separate, and then they have this isthmus right here, and then they form exit separately. And then we move on to the interradicular area, which looks okay. Slight periapical infection or a periodontal infection right here. And then we move to the distal bit, and the distal root is only one single canal which gets wider in the middle and then becomes narrower. So this is, we can say this 1-to-1 configuration of just one big single canal. This is the axial view, and here you can very clearly see, there we go. Moving further down, this is the chamber. Now we moved into the root. So this is the mesial root, this is the distal root, one wide canal. You can very clearly see right in the distal, two separate canals in the mesial, and here it slightly separates into two canals, 1 and 2 in the distal. This is the 1 and 2 in the mesial. And you also very clearly observe the 7 is compressing the root distally. It's compressing the 6, and also there is a significant cavity in the 7 as well. This cavity is actually encroaching into the pulp space, so this definitely is leading to pain and periapical infection. Just to give you another idea, the 7 is also very closely associated. So I'm going to take you to the 7 now. So this is the 7 grossly calious, the 8 is over the 7. This is the chamber space impacting into the bone, compressing the nerves. You can very clearly see here the kidney bean shape is also the nerve being compressed by the lower left 7. Incomplete, so even extracting this tooth is going to be significantly difficult, and doing a root canal in this tooth is also going to be very significantly difficult. If you have any further questions, please feel free to let us know. This is part 2. So this is the upper left segment endodontic mode. This is the sagittal view. This is the transaxial view. So here you can see implant placed very well, center of the ridge, partly into the sinus. There is immense sinusitis that we can see here. Moving to the upper left segment, even though the doctor asks upper left 6, the 6 looks okay, the implant looks perfectly fine. This is the upper left 7 region, and here you can see we've got the mesiobacterial root. The mesiobacterial root has two canals which join to form one. We've got a single parietal canal, and then we've got a single distobacterial canal as well. And the single distobacterial, the distobacterial root unfortunately is longer, has a periapical radiolucency. This is the mesiobacterial parietal root, and then this is the mesiobacterial. So mesiobacterial root is definitely shorter. We've got approximately 21 millimeters, whereas the parietal root is going to be 19 millimeters. Sorry, the distobacterial is going to be roughly 20 millimeters as well. Thank you very much.